Hello, my name is Odetta Gentoli. I'm a licensed clinical social worker here at the Thomas H. Corey VA Medical Center. I'm also a doctoral student here at Aspen University. Today, we'll be diving into some crucial information regarding ethical considerations within organizational psychology. As professionals in this field, I've been a professional licensed clinical social worker for about 20 years now, always worked in the mental health, substance abuse field. We've often worked with individuals or groups to maintain ethical standards is a paramount. We have to do it when we're working with them. Today, we'll be focusing on 4 key areas, including client confidentiality, informed consent, the transition of clients that are turning 18 from childhood to age 18, turning into adults, and parental notification. So let's begin with what client confidentiality is. In any setting that provides clinical or medical care or any organizational setting that does work with clients, this applies to information shared during the assessment, treatment, and any and all information related to the patient care. It's the principle of keeping the client's information private and only disclosing it with their explicit consent or when legally mandated. Also, it is a need-to-know basis. So even though we have consent, we may not disclose everything they're talking about. It's definitely need to know for that specific situation. Even in research, we consistently highlight the importance of building trust in a relationship when we're working with our clients, and developing confidentiality and them understanding that we're not going to say anything they say unless they want us to is the cornerstone of that. Working with veterans is very, very special to get that trust, to build that trust with them, because they have a hard time trusting clinicians. So when I first started working with them, I do tell them about confidentiality, and I'll discuss the limits of it. So with ethical practice, we definitely want to define the information that is considered confidential. We want to develop within our organization ways that we can secure the data that we're getting and handling procedures. So if we have paper notes or a form that the veteran may have filled out, how do we store it? How do we deliver it to somebody else so that it's only going to the person that it needs to go to? We only share what is, like I said, a need-to-know basis, and that is only with consent. The APA ethical principle of the Psychologist Code of Conduct, Standard 4, really emphasizes that maintains the confidentiality of patients. We all have ethical obligations to confidentiality. It's not only a legal requirement in many cases, it's a critical factor, like we discussed, to build that rapport, to develop a safe and trusting environment. If we don't have that confidentiality, our individuals that we're working with are less likely to tell us the truth, to be honest. And this is going to really hinder their ability to move on, to process, to get the most out of their treatment. Informed consent. Informed consent involves ensuring the client fully understands the nature, purpose, and potential risk and benefits of any interventions we're giving to them. So with research, the interventions that we may be doing as research, we want them to know as much as possible what we can tell them. It might be difficult if we're trying to do some deception, but that's where later on in a different conversation, we talk about debriefing. When we are providing clinical services or therapy or something like that, a specific like EBT, evidence-based therapy, we want them to agree to participate in it, and we want them to know all of the benefits and potential risk there are to that therapeutic process, so they can really fully understand and give their full informed consent that they want to participate in that. We want to use language that's easy for them to understand. We want to give them time to ask questions and consider all the options they may have. When they do give consent, we want to document that thoroughly. Usually we have written releases of information for confidentiality or different releases for the evidence-based therapy, so they know exactly what they're getting into. It's important also, when we're talking about confidentiality and informed consent, to discuss the limits of it. So in cases of child abuse or abuse of a vulnerable adult, if there's risk of, or if they disclose any abuse, neglect, or exploitation, we do have a mandated to report that information. In cases of where they might feel some suicidal or homicidal ideations, we may have to report that as well. So when we're providing them informed consent, we want them to be very, very aware that in these situations, we may have to break confidentiality for their safety and the safety of others. Informed consent empowers the clients, giving them autonomy over their participation in what they're going to and in their treatment. It protects the organization as well by demonstrating the client's willingness to engage in the treatment. I'm not really an expert with minors. I've really only worked with adults. I've been with the VA almost 13 years. But those that have worked with minors, we want to make sure that they are unique, that we understand they're unique clients. And turning 18 when they're in mental health treatment does pose some sort of a little bit more discussion and conversation we have to have with them. We have to really pay attention to any legal and ethical concerns. Most of the time when children are working with therapists, their parents are involved and their parents give informed consent. All those informed consents need to now be redone with the now 18-year-old as the person signing off on them. We want to prepare them for that transition well in advance. We want to let the parents know and the child know that when they turn 18, the parents may have limited access to their medical records and to discussing their situation. And it's only going to be what the adult at that point in time wants to discuss. We should try to get informed consent written from the patient once they turn 18 that their parents can be involved, or that they can give the informed consent of what kind of treatment they want, and even if they want to participate in treatment. We want to adjust any changes that might be in confidentiality, access to the records, and things like that. HIPAA plays a huge part in dictating the shift of control of the medical treatment and mental health information. This transition can be complex, especially if the client was dependent on their parent in other ways. Clear communication with all parties to adherence of me to the legal requirements are essential to smooth the transition with the child turning 18. Parental notification, again, I haven't worked with children that much. I've only worked with adults, but we want to look at when something's going on, we want to be able to tell the parent when we're working with minors. So when we're working with minors, kind of like we talked about before, we need to get the parental consent. We need to discuss with the parent the different kind of clinical techniques we may be using. We want to clearly define the circumstances under which the parents will be notified, such as cases of specific harm or legal requirements. This is kind of funny because if a child discloses to me that the parent is abusing them, I'm a mandated reporter. So I may not discuss that with the parent, but I'm going to have to call the abuse hotline and report that to be investigated. We want to maintain open and honest communication with the minor and their parents. All the parents have to do, they do have to sign off on all the confidentiality and all the paperwork while we're working with the minor. I think that if I'm working with a minor and they're disclosing stuff to me, I would want to discuss with them what they want me to disclose with their parents. In less than severe cases, I might discuss that I might have to tell the parents. I would want the child to have autonomy and to feel like they could tell me when or when not to tell their parents something. If there is a case where I feel that the parents do need to know about a situation, I'll talk to the minor first and tell them exactly why we're talking about the situation, what exactly I'll say, and that I'll be there to support them regardless of the parental reaction. It can be very challenging to balance these rights between the client and the parent. There should be clear policies and procedures that the organization should have to comply with the legal aspects of all this. So in the workplace, this is less likely to occur unless the company is providing mental health services to a dependent or employees, and we don't do that at the VA. We refer out to family programs. So I'd like to thank everybody for joining me today for this discussion of informed consent and confidentiality and working with minors. Thanks so much.